breast cancer treatments come many side effects, often managed by more medication. A law that went into effect on July 1st of this year may give breast cancer patients in the Commonwealth another tool in their belt to help with all those additional symptoms. Reba Hollingsworth looks at how Virginia's new regulated medical cannabis program will affect breast cancer patients.
I felt like I had done everything in my life to try to avoid cancer. To say it was a shock is an understatement. I had two very young children. My daughters were 4 and 2 years old. And I was flawed. I didn't think that I would be a breast cancer patient.
During treatment, Bernice O'Donnell experienced many common side effects of chemotherapy. At the time, medical cannabis wasn't legally available.
With chemo, I ended up being nauseous like so many other chemo patients. And to combat that, the doctors prescribed anti-nausea medication, which was helpful. However, with chemo, you end up having difficulty, for me at least, difficulty passing food. And then the anti-nausea medication made it even more challenging to pass food. Current day, if I had gone through it, I would have tried the medical cannabis.
As of July 1st, patients in Virginia now have the option of using medical cannabis through Virginia's regulated medical cannabis program.
Patients have been able to find relief from the side effects of chemotherapy by using medical cannabis. Relief for issues like pain, nausea, loss of appetite, and sleep disruption, as well as anxiety, and not to mention pain that may be associated with the cancer itself.
Jen Michelle Padini of Virginia Normal says medical cannabis can be an alternative to opiate prescriptions. She says data from other states struck a chord with legislators in Virginia looking for a solution to the opiate crisis.
It will have the same results here in Virginia that we've seen across the country, where we're seeing very quickly about a 25% reduction in opioid overdose fatalities and increasing up to about 35% after just a few years.
For patients like Bernice, the extra option is one more way to get through a tough treatment.
Your life is not normal when you're going through treatment, but any benefit, anything that can make your life that much more comfortable is such a huge plus that it would be worth it to use it.
Right now, the first dispensary in the state, Dharma Pharmaceuticals in Bristol, is expected to open any day, and G-Leaf is expected to open in Richmond at the end of the month. The Virginia Breast Cancer Foundation is holding a free webinar about medical cannabis for breast cancer this Thursday at 4 p.m. For information on that and to find out how patients get access to medical cannabis, log on to our website at WTVR.com. For Buddy Check 6, I'm Reba Hollingsworth.